Welcome to Suhail's Paramedical and Nursing Academy. Today I was thinking that I will upload a video about something in nursing foundation, because we are always thinking, we are always knowing that we are always knowing the things by means of our tongue, but we don't do in the practical life. Today I want to show something in our practical life. The thing today I am going to show in nursing foundation, particularly when we are going, but whether it is a physiotherapist, whether it is any nursing student or any paramedical student, the paramedical student or nursing student or any other, even the doctor also, they should know about the range of motion exercise. The range of motion exercise is an important topic that we should show practically. How range of motion exercise we have to do. In range of motion exercises, first we should know what is the range of motion exercises, why we are doing, what are the indications, what are the contraindications, and what should we do before going to start the procedure. First of all, I will tell that the range of motion exercises, why we are doing the range of motion exercise. The range of motion exercise we are doing because the patients, first this is an indication which patient we should do this. The patients, or even though this is not only for patients, the people who are living in the home, they can also follow this procedure, but particularly we are the medical and paramedical students, so we should know about in hospital how we have to do this. So today I am going to show about range of motion exercise. The range of motion exercise we are going to do for those patients who are bedridden for longer time. Suppose when the patient is bedridden for the longer time, the patient will not be able to move for longer time, and the joints of that patient will not be so much flexible, so the joints will be stiff. For to decrease the stiffness of joints, to make the patient movable, to make the patient's joints easily movable, so we are giving range of motion exercise. A range of motion exercise, one is better in patients, another is, suppose if the patient is suffering from rheumatoid arthritis, where there is stiffness of joints also, so in case of rheumatoid arthritis also we can give range of motion exercise. And also for those people, suppose in case of ortho cases, in ortho surgery cases, the people are bedridden for longer time because they are having surgery in their upper limb or lower limb. What will happen? The patient will not be moving for longer time, so we have to give range of motion exercise so that the patient will try to move from one place to another place easily. So because he is bedridden for longer time, the patient is not able to move because of fracture in one limb. So when there is fracture in one limb, other joints are also at the same place, so we should not move. And one more thing that I will tell in the future, we should not move that part which is having any suppose any kind of pain. If the patient is having pain in any part, that part we should not move, we should not touch that part. So that is another thing. First, what is the range of motion exercise? I told range of motion exercises are the exercises, these are the exercises that we are providing for the patient or any person in order to decrease the stiffness of the joints, in order to make the joints movable, in order to make the person easily to move. So range of motion exercise, not only this, even though the muscles which are joined with the which are linked with the bones, the muscles will also cooperate with the exercise. When muscles will also cooperate with the exercise, definitely the exercise will occur in muscles also. So muscles will also become strong. So there will occur strength in the muscles also. That is one more thing. So joints, muscles will also become strong by means of range of motion exercise. So suppose first where we are going to start, so this is the indication and contraindication. Suppose if the patient is having pain in any part and any limb, so we should not touch that limb or that part of our body. We should not show any range of motion exercise until the patient is safe. Then only we can do. Otherwise, if the patient is having pain in any limb or any fracture in the limb, then we should not do range of motion exercise to that limb. Actually, we are just moving the joints. The joints we are moving, we are showing the movement of joints. In range of motion exercise, first we are starting from head and we are going towards the toe. From head to toe, we are doing a range of motion exercise. Then what will happen? This is the range of motion exercise from head to toe. This is first thing. Second, when we are going to do the range of motion, first we have to tell to the patient, we have to explain the procedure to the patient, that what I am going to do. After explaining the procedure, then we have to see the comfortable position of the patient. The patient should be in comfortable position. Suppose the most comfortable position is supine position. If the patient is in supine position, it is comfortable for the patient, then definitely we can do this procedure. And I came for the, because my right side is right hand is dominant, right side is dominant, so I came on the right side of the patient. This is one more thing, right side of the bed. This is another thing we have to remember before starting the procedure. Third thing is, we have to tell the patient if there is any pain in any joint. Any pain in any joint, we have to tell the patient before the procedure. Then only we can know that we should not move that part of the patient. So I am starting from head to toe. I told the patient, you are having any pain? The patient will respond, no, I don't have any pain. Suppose I will tell to this patient, here is a patient, my friend is here, Mr. Sirikan. So he will give me some responses. Now there are two types of range of motion exercise. One is active range of motion exercise, another is passive range of motion exercise. In case of active range of motion exercise, I will be only showing how to do the range of motion exercise. The patient will cooperate me, and the patient will also do the same thing what I am doing. That today I am going to show. Another is passive. The passive means when the patient is not able to move the parts, when the patient is not having so much of strength, so much of ability, then the patient is not having so much of ability that he or she can move the joints easily. So then that time we are helping the patient to do range of motion exercise. That is called as passive range of motion exercise. So passive means no energy use, active means energy use. So patient is using the energy, it means active. Patient is involved, it is active range of motion exercise. Patient is not involved, that is called as passive range of motion exercise. So it is called range of motion. So range of motion, we are making a range we are making in the motion. So we are creating a motion in the patient by means of exercise. That is called a range of motion exercise. So I told what we have to do before the procedure. Then we are going to start the procedure. And when we are going to start the procedure, from head to toe we have to start. Suppose I am going to start first from the head. So here this is the patient, and I am going to show that here both active as well as passive. Sometimes I will be involved with the patient. That time we will call this as passive. When the patient will do itself, then I will show here. The patient will also do. Suppose first we will start from the head, from the neck. So in head we will start from the neck. Suppose first there is neck rotation. So we have to rotate the neck. For neck rotation, we will do like this. First neck rotation, patient will also do the same. Neck rotation through, suppose patient yeah. This is neck rotation. Patient will show. I am going to do neck rotation towards the right side. Neck rotation towards the right side. Then neck rotation towards the left side. Okay. This is called neck rotation towards right side and towards left side. Okay. This you can see from the patient that he will be also cooperating with me. What I am saying, he will also do the same. First thing is neck rotation. Then there is lateral flexion, extension, and lateral flexion. See, right side lateral flexion means this is my head. Right side lateral flexion he will show. He will move the head this way. Right side lateral flexion, extension. First right side lateral flexion. Now extension means normal position. Now left side lateral flexion. Left side lateral flexion. Now extension. Right side lateral flexion. Okay. So this is about the lateral flexion and extension. Now we will go. This one rotation and extension I have shown at the neck position. This is at the neck. Now we will move the neck another way. One is called as flexion, extension, hyperextension. See, this is when the chin is going towards the body, towards the chest, then it is called as flexion. This is flexion, extension, straight. Now it is straight. Extension, hyperextension. When we are moving the head towards the back side, it is hyperextension. See, one more time. Flexion, extension, hyperextension. This is neck movement, another neck movement. Because in flexion and extension, the body is moving. When the body part is moving towards the body part, it is called a flexion. When the body part is moving away from the body, it is called as extension. When when more force is used to move the body part away from the extension position, then it is called as hyperextension. Okay. So patient is also showing. See, once more he will show flexion, extension, hyperextension. Okay. Now we will go towards the this was about the neck. Now we will go towards the shoulder joint. This is called a shoulder joint. In shoulder joint, we will start from here. This is shoulder joint. We will start in flexion and extension. See, this is called as, see, this is this way position. This is the position. This is called flexion. See, upper side flexion, like this way. Patient will show flexion this way. Patient is raising the hand. This movement, joint movement. See, flexion. This is flexion. Now extension. See, flexion, extension, flexion, extension. Shoulder joint is moving. Same. Now this was shoulder joint. Now we can move this shoulder joint away from the body or towards the body. See, this was like this way. Now we are going to this way. One is called as abduction, adduction. See, towards the patient also. Abduction, adduction. So this is also the movement that we are going to do in the shoulder joint. One was flexion, extension. Another is flexion. You show flexion and extension. Okay, flexion, extension. This shoulder joint is moving. Now I will show adduction and abduction. Adduction. So suppose first abduction. Now adduction. Abduction, adduction. Adduction means the body part is moving towards the body organ, towards the normal position of the body. This is the normal position. This limb is going towards the body. It is called adduction. It is adding to it is going to add with the body, and it is going away from the body. It is called as abduction. This was shoulder joint. Now we will go towards the. This is called as what? This is called as elbow joint. This is called as elbow joint. So in elbow joint, what we are going to do? One is called as extension, flexion. This is called flexion. This is called extension. Flexion, extension, flexion, extension. So this is in the elbow joint. One more thing. This is flexion and extension in elbow joint. Now we will go towards the wrist joint. In wrist, see, this is the joint. In wrist joint, what we are going to show? This is the wrist joint. Suppose this is wrist joint. One is called as. See, this one is called as. See, one is called as. See, this is the wrist joint. One is called as flexion. This flexion, wrist joint, flexion, extension, hyperextension, flexion, extension, hyperextension. This is the wrist joint. Now in the wrist joint also same. See, in the hand, in the wrist joint, what we are going to do? We will do pronation. See, now this now here what will move? This elbow joint will also move. We are going to show pronation action. See, this is called as what? This is suppose this is the normal position. This is called as supine position. This is called as supine position, normal. So this is the supination. We are going to show now pronation. Supination, pronation. Supination is this way. When the hand palm is on the upper side, it is called as supination. When the dorsum is on the upper side, it is called as pronation. Okay, this is pronation. Now we are going to show the thumb. This is thumb. We are going to show thumb rotation. This is thumb joint here. The joint at the thumb is called thumb rotation, because here we are going to move. Because in hands and lower limbs, in hands and foot, we will move tarsal and metatarsal joints also. Tarsal and metatarsal also joints should be also moved. So see here, this is the hands. This is the hands. He will also show. This is called as abduction, going away from the body. Adduction, abduction. Now adduction, abduction, adduction, abduction, adduction, abduction, adduction. Okay, this is abduction, adduction in the fingers. This is thumb rotation. In thumb rotation also, this is flexion, extension, hyperextension, flexion, extension, hyperextension. In finger, in thumb joint also, we are going to show the range of motion on the side. So this was all about this limb, upper limb. Same we are going to do the left limb. So this is same. What is happening? Now we are going to show the hip. This is called a hip joint. In hip joint is what we are going to show. Now the patient is on the lying position. Now he will show at the lying position. I will show from the patient, because I can't move here. It will not be good. This is called as, now I will show passively. I will help the patient. This is called a hip joint. In hip joint, when we are going to move this way. Suppose this way, this is called as flexion. This is called as extension. Now it will move. This is called flexion. Extension, flexion.
Oh.
Extension.
Flexion is flexion, right?
Yeah, this is flexion. See, when we are moving the joint, this is the joint here, hip joint. When we are moving the hip joint towards the upper side, towards the away from the other limb, then it is called as flexion. See, this is flexion and this is called as extension. In flexion, we are going flexion. Actually, we are going to flex the leg. This leg is going towards the body part. It is called a flexion towards the thoracic, towards the thorax part of the patient. This is called as flexion. Now this is extension. Same for this patient, because here hip joint is moving. Hip joint is moving. Flexion, extension. Flexion, extension. Okay. This was. Now there is rotation of the hip joint also. In rotation, see, this is called as, see, in rotation, this is inward rotation, outward rotation, inward rotation, outward rotation, inward rotation, outward rotation. So here this hip joint is moving. This is the hip joint, how hip joint is moved. Now we will go towards the knee joint. In knee joint we will do the same. This is called as flexion, extension, flexion, extension, flexion, extension. This is how knee joint should be moved. So this was one more thing in the knee joint. Now we are going to show one more thing. Suppose this is the two parts of the body. These are the two lower limbs. These are the two lower limbs. If the lower limb is moving away from the body, see, he will also show when the lower limb is moving up away from the body, it is called as abduction. When it is going, one limb is going towards other limb, it is called as adduction. Abduction, adduction. This is one more part. Here also the hip joints are moved. Hip joints are being moved. So what will happen now? We will go towards now where? Towards the wrist, towards the hip. This was hip joint, knee joint. Now we will go ankle. In ankle, what we will do? See, in ankle joint, we are going to do two things. One is called as inversion and it's called as exversion. See, this is inversion. Inversion means this palm is moving towards the other. To this palm, the foot palm, the foot. There are two parts of foot. One is called as dorsal part of foot. Another is opposite to the dorsal part. So this dorsal part is going away from that foot. See, now this foot is this is the normal position. This foot will move towards other foot. It will show the face towards other foot. This is called as inversion. Now it will move away from that part. It is called exversion. See, inversion, exversion, inversion, exversion. So here also the joint is being moved. Now what will happen? We will show one more thing. That is called as flexion, extension, hyperextension. See, here it will be also. This is called a flexion, extension, hyperextension. Flexion, extension, hyperextension. See, here also three movements are being done. So here will be also thumb. So thumb for arm also we will do thumb rotation. This is thumb rotation. We are doing thumb rotation. Okay. One more thing is here, that is called in flexion, extension and hyperextension. We can tell one more. We can tell the same terminology. The good terminology is dorsiflexion and plantiflexion. When this foot will move towards the body part here, where we were saying flexion. Now we can call this as dorsiflexion, plantiflexion. Dorsiflexion, plantiflexion. See, dorsiflexion, plantiflexion. Same terminology that we are using other joints. That is flexion and extension. Here we will say dorsiflexion, plantiflexion. Dorsiflexion, plantiflexion. See here, dorsiflexion, plantiflexion. Okay, this was at the lower limb. I was showing the joints. Now fingers also. For fingers also we will show. These are the fingers. Fingers. We will show abduction, adduction, abduction, adduction. See, abduction is away from the other finger towards the same finger, that is called adduction. Abduction, adduction. So this was one more point. Then there is also thumb. So we will show the thumb rotation. This is thumb rotation. So this was how we can move the joint, how we can move the different joints. And there are some more exercises are there in addition to joints that we are not adding here, because these are the most important exercise points mostly at the joints that we are going to show, that we have shown in this video. But one more thing I told you, that suppose if the patient is having any pain in this joint, if the patient is having joint pain in this joint, then that time we should not move that part. So then we should restrict that part. The movement of that part we should restrict it. Some patients have restraints. Restraint means they will be having some equipments will be used so that body part should not move. They are called as restraints. So those body parts should not be moved. So that is why we should prevent movement of that body part. So presence of restraints is an indication that we should not move that body part. This was one more thing. This was all about the range of motion exercise. In this range we can do in our normal day-to-day life also, we can do this range of motion exercise. So today I have explained about the range of motion exercise. In the next lecture I will give some practical also same things. I will explain about the suppose one more topic I will tell, that is how we can use the gloves, how to put gloves in the hand, putting gloving I will say how to gloving. And one more thing is there, I will say one more practical, that is hand washing, surgical and medical hand washing. In the next lectures I will tell that. So this was all about range of motion exercise. Okay, thank you.